medicine students and other for the nursing students. And then we'll be doing the chunks of this role play. Okay, so let us start this. I'm going to play the patient's part for you, and you can call me Joyce during the role play.
Okay. So, hello, Mr. Joyce. How are you today?
Hello, doctor. It is still the same, Uh, I still have this stiffness in my hand and, the spasm in my foot. Uh, it's all the same.
Okay. Uh, I think in our last visit, I prescribed you L-Dopa for your condition, Parkinson's disease. Are you taking that medication?
Um, Frankly speaking, doctor, I am someone who doesn't like taking chemicals. So I haven't started it yet because, again, I don't have tremors. So I think it is not, necessary at this stage.
Okay. And this muscle spasm that you are describing, how long you you are having?
Um, like when I met you last time, I told you that it was going on for about 4 weeks then. So now it has been 2 months since I'm having this spasm and, stiffness in my hand.
Okay,
But I
Mr.
wanted
Joyce.
to know, like, can't I manage with some exercise or some other methods instead of taking this drug? Because I really don't want to take chemicals for a very long time.
Okay, Mr. Joyce. I think it's a very good question. But before answering that question, I need to ask you a few questions, and uh, probably later I can answer your question. So, how much do you know about the Parkinson?
Um, I just know that it causes stiffness, but I don't really understand why is that so.
Ma'am, can words take me over,
Hmm.
please? Now.
Yeah. So who is the next one? Who is supposed to explain?
So,
Good evening, ma'am.
Yeah, Uvesh, go ahead.
Hello.
Yeah, go ahead.
Good evening, ma'am.
Good evening. How would you start this? Go ahead.
Yes, ma'am. So, Mr. Joyce, are you aware of the
See, why
Parkinson's
I
disease?
don't know why are you guys saying Mr. Joyce? When your interlocutor is female, address
Sorry.
them by So you will say Miss Joyce.
Okay, sorry. Okay, Miss Joyce, are you aware of the Parkinson's disease?
No, I don't know much about it. I just know that a person can have tremors or it may cause some stiffness, but I don't really understand why is that so.
Okay, good to hear that you have the little bit of information, but the correct one. So, what I want to do is I want to explain you in detail about the Parkinson's disease. May I proceed?
Yes, please.
Yes, thank you for the confirmation. It is a disorder of a central nervous system in which damage to the nervous cells occurs and it leads to drop in the dopamine levels. Are you following me?
What is dopamine?
Yes, it's a chemical which regulates the muscle activity, which called as a neurotransmitter in our nervous system.
Okay.
Okay, so now I want to tell you about the symptoms which you may experience in the Parkinson's disease. May I proceed further?
Yes.
Yes, so firstly, you will experience symptoms about the muscles that you can experience muscle stiffness and you can also experience tremors. Okay, the secondly, you understand the you experience the symptoms about the daily routine activities like walking and running and just uh, 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 and you also may experience around symptoms about the cognition that you may be confused, you may be feel confusion in the evening, and your sleep can be disturbed. uh, um, are you following me?
Yes, I do.
Yes, I know it's a lot to take in, but I hope I explain you well.
Yeah, but then, how, like, if I have all those issues, I think exercise would be a much better option. Like, why do I need to take this medication?
So I know that change in the daily routine activities might be difficult for you initially, but now I want to just explain you treatment options, which are uh, medicines and physiotherapy that include the exercise which you talked about. So may I explain you further?
Yes,
Let
please.
me explain about the physiotherapy, Miss Joyce.
Yes,
Yes.
yeah, Anil, I know that.
Along with
Wait for a minute. He first needs to explain about the medicine, and then I'll ask you to explain the physiotherapy.
Okay, okay, Ms. Joyce. So, as I said earlier, in Parkinson's disease, the level of dopamine drops. So, I want to just, as I prescribe you medicine, dopamine, which you have to take regularly. It will help you to it will help you to get a good health condition. And I want to give a referral to physiotherapy. And a physiotherapist will explain you some exercises which help you in the muscle stiffness. Okay,
Um,
ma'am?
I think Uvesh, you have slightly misunderstood your role. You had to cover the first two bullet points. So, how would you explain more about the medicine? How the medicine will benefit? I was asking why do I need to take medication? Because all the symptoms that you described were related to movement, right? So, why can't
Yes,
I
ma'am.
just go with physiotherapy? And why do I need to take medicine? So, you have explained that I have prescribed dopamine, but I
Yes.
was expecting you to explain more about how dopamine works and how it will be helpful in either preventing the deterioration of the symptoms or alleviating current symptoms.
Okay, ma'am.
So let us start from here again. Why do I need to take this medicine?
Yes. Would you mind telling me that have you been adapted well with the medicine?
Again, it has been told already, isn't it? I told already that no, I haven't started medicines yet.
Okay, ma'am. Okay, ma'am. Okay. So I want, as I prescribe you dopamine, L-dopa medicines, which help you to increase the concentration of dopamine in your blood that decreases regularly in Parkinson's disease, which will definitely alleviate your symptoms and you will feel better day by day.
Okay, so elevate and alleviate. They are two different
Alleviate.
words.
Yes, ma'am.
Alleviate.
Yes,
Alleviate is the
ma'am.
right word.
Okay, ma'am.
Okay, okay. Who was next? Anil, go ahead.
so now, let me also explain you some causes which can lead to some reasons which can lead to Parkinson's disease.
Mm-hmm.
So, one can develop Parkinson's disease because of some trauma in the past, like some head injury,
I
or it
see.
may also be because of exposure to some toxins. Uh,
Mm-hmm.
and in some cases, actually, there is no reason. The reason is unknown.
I
So,
see.
in this condition, as I mentioned earlier, uh, a patient should be benefited by taking uh, the chemical called dopamine, which I've already prescribed you. And other thing is physiotherapy. I strongly suggest you should follow a physiotherapy Now let me explain you how physiotherapy will help you in improving your symptoms.
Yes, please.
Shall we continue?
Yeah.
Yeah. So, firstly, by doing physiotherapy, it will help you with in improvement in movements.
Okay.
Like you are already having stiffness of your hand, you are
Mm-hmm.
not able to move your hand. This is
Mm-hmm.
because the lack of the enzyme dopamine. Now,
Mm-hmm.
along with the enzyme which we are supplying, we need to do some exercises for the muscles to maintain their tone and their power.
Mm-hmm.
Second thing, like when you are walking, you might have some shuffling. You may feel like you will fall. While doing physiotherapy, your muscles will become strengthened and it will help you in, improving your gait.
Okay.
Secondly, we do,
Sounds great.
yeah. Secondly, when you do chest physio, like breathing exercises,
Mm-hmm.
Parkinson's, weakens all our muscles. It can also weaken your respiratory muscles, your lung muscles, right?
Mm-hmm.
So, in long term, it would be helpful. So,
Okay.
I recommend you must continue with both the treatment strategies. I know it is a lot to take in, but I hope you will follow the instructions.
Yeah, I have always liked doing exercises, so I think I would definitely be able to follow the exercise routine. That won't be a problem for me. But the only concern I have is that, why do I take these medications unnecessarily when a lot of benefit can be taken from the exercises? So
In
that's over to you, Dattu, the last.
No, it's me, Vandana.
Okay, Vandana. Okay, yeah.
Yes, it's a really important, wonderful question. First, I want to tell you that this is a neurodegenerative condition as we discussed earlier, right?
Mm-hmm.
So, whatever symptoms that occurred cannot be reversed from the normal as you was normal in the past. So only the treatment part of this condition is either we can reduce the severity of the symptoms or we can reduce the progression of the disease.
I
So both
see.
both the parameters are needed and the exercise that help you to reduce the severity of the symptoms. Like for example, you are coming with are you coming with spasm on your foot, right?
Mm-hmm. Mm-hmm.
And this physiotherapy that I explained you earlier that reduce your spasm and encourage your muscle to strengthen more that will help you to do a routine activity more effectively, right? Am I clear so far?
Yeah.
Yeah, but on other hand, it's really important to take medicine because the therapy only reduces your symptoms, not your progression of the disease. So for better prognosis, you need to take oral medicine that I prescribe you. Am I clear so far?
Yes, doctor. Very much clear.
Yes. Okay, so now I'll prescribe you the L-Dopa on the daily basis as well as I assign you for the physiotherapy session from next week. Could you able to do?
Definitely, I'll follow that schedule.
Okay,
Thank you for
well
helping.
then. And we'll see you in after 10 to 15 days to see your progression.
Sure.
Have a nice day. Goodbye.
So now let us have the feedback. So, Utsav, you started well by setting up the context, but instead of directly saying, how are you feeling now, you could have set the context first. So, this is our follow-up visit, and when we met last um month, I suggested this. So, have you been taking these medications? And then asking, so how are your symptoms now, or how are you feeling now? That would be appropriate way. Uvesh had slightly misunderstood the task. So you did well in explaining what the Parkinson's disease is. But if you could have explained it more in detail, how the L-DOPA medicine actually replaces the chemical. Okay, or you could have used the word supplement. So your body is not producing enough amount of chemical, and therefore we need to supplement it from outside, or we need to replace that from outside, and that is why it is very important to take this medication. And again, as Vandana said rightly, that taking this medication would make sure that their symptoms do not worsen, or the prognosis of their condition. I think prognosis would be the word that patients would not very much relate to. So instead of that, if you clarify them that, it will prevent deterioration, or it will prevent worsening of the symptoms, or it will control the symptoms, or alleviate the symptoms, that those terms will be easier for them to understand. um, Anil, a lot of improvement in rhythm and tone, and you were able to handle all the aspects accurately using signposting, detailed explanation, so that's perfect. And Vandana, you also did really well. If you could have just used any of these words, supplement or replace the chemical, so then it would be much more clearer for them that somehow we need to make sure that the level of that chemical remains normal within the body, and for that medicines are necessary. It cannot be replaced or supplemented by doing any other form of exercises. It can only be done through the medication. Another other points you can try to make here about the medication is by explaining them that this medication does not have a lot of chemicals. It is just the same chemical that you have in your body, but this one is a synthetic one. um, Convincing them that the medication does not have many side effects. Okay. And then making a point that uh, they would have to take this medication for rest of their life. That's something again very, very important. So even if they do exercises and everything, the medication is still a must for them. Okay, so everybody did fairly well. Now I'm going to have second round, but after a pause of 10 minutes, because I need to take up the nursing candidates task as well. So those of you who have been preparing can keep preparing. Maybe one pair out of those who have already completed this can take the whole role play with each other. You guys can decide, one of you becomes a patient and the other one becomes the doctor, and then take the roles. Like for example, half of it can be done by Anil and Uvesh, and other half can be done by Utsav and Vandana. Okay, so you do it yourself for the next 10 minutes, and then again I'll come back and I'll do this role play with you.
Hello. Hello, Uvesh.
Yes.
Okay, so Manju and Divya, are you both prepared? Are you both prepared with your script? Yeah. Okay, so let us give it a try. Let's see how you have been doing, and then I will be suggesting you which are the areas for improvement, right? Don't hesitate, just try to speak as clearly and as much as you can. So Manju, I'm going to play the patient's part for you. You can start speaking now.
Okay. Okay. Good morning. My name is Ranju. I will be. I'm here today, your nurse, to see you. How are you?
Hello, nurse.
Hi. Hi. Take a seat. How are you?
I'm not feeling well, because I have a lot of swelling in my foot. I don't know, what is causing this, but it's really painful. If you can have a look at it.
Sorry to hear that. Okay, when did oh, it's not uh, it's not very reddish, and I can see it's really swollen. Okay, when did you notice this first?
Manju, you're sounding very low. If you can. speak little loudly.
You know,
Yeah.
okay, when did you notice this cut?
It was about 6 weeks ago when I was gardening. During that time I got a cut because of a metal piece. And it was a very small cut, so I thought it will, get healed on its own.
Oh, sorry. Oh, that means you're saying now it's nearly 2 weeks that you had this cut.
6 weeks.
6 weeks.
Yeah.
Okay. 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 How is the pain like?
It's too painful now. Initially I couldn't even sense it, but now I have pain.
You have pain, and okay. And do you feel any sensation on the place around the cut?
No,
You can't feel anything when you touch.
no.
Sorry. Sorry to hear that. Okay. Um, okay, I can see you are diabetic, isn't it?
Yes.
So I hope you know. Do you know what is diabetes?
Yeah, the nurse had explained me, and yeah, I'm aware about diabetes.
Okay. So because you are diabetic,
Yeah.
I think you left it too late because it's nearly going to be 6 weeks. So um, because you're diabetic, if you won't if you don't take care,
Hmm.
it's it going to be it's resulting ulceration, and you end up amputating your leg. That means you need to cut off your leg.
I see.
I know it sounds hard, but I have to tell you because we need to treat it. So
You
don't
mean to
worry.
say you mean to say that I will have to cut my leg off?
No, there is a solution.
Okay.
We can treat it.
Mm-hmm.
So you just need to follow the doctor advice.
Mm-hmm.
You need to you need to come and do the dressing regularly,
Mm-hmm.
and you need to you if you if you take your tablet correct time,
Mm-hmm.
that will help to heal your wound as soon as possible, and you can heal from there.
Okay. But will it heal completely, or would I have to cut my leg off?
No, definitely it will heal. It will heal completely
Okay.
if you take care of it. Definitely it will heal.
Okay. Okay. That's a relief. Okay. Over to you, Divya. How would you
Uh,
start your point?
uh, what I am going to do now is discuss the importance of proper food care.
Okay.
Is it okay for you? Is that
Yes,
okay?
please. Yeah.
Firstly, do you trim and cut your toes nails and keep it always clean?
Mm-hmm.
Um, it can help you to prevent further infection. Um, Then, secondly, do you clean and dry your feet with washing with soap and moisturizing your skin? Um, for this reason, you can prevent infection. Uh, is that clear?
Yeah, I can do that.
Okay. Um, then, do you change your socks daily?
No, I don't.
Um, I would like to give I would like to give recommendation. Do you change your socks daily because you have food ulcer, no?
Mm-hmm.
So you didn't change your socks daily means it will affect your food and further infection. You can change your socks daily.
Okay. And
Uh,
about the shoe fit, you need to explain about the shoe fit, proper size of the shoes to avoid friction, stress, and pressure sores.
okay. Uh, uh, how I will ask question, ma'am? Like to shoe size, like
So here you would say that, apart from that, what is important for you is to make sure that the shoes you are wearing are of proper size. Because if the shoes are too fit or too loose, then they can cause friction. Okay,
okay,
and the material of the shoes that you are using should be very soft so that it
okay,
doesn't cause any stress or it doesn't cause any pressure sores.
okay, okay,
So that's how you can explain. And whenever you are giving explanation, you wouldn't say, "Do you change your socks?" Because "do you" is used when you want to ask questions. Do you change your
okay,
socks? That is a question. But if you
okay.
want to say, you should say, "You should change your socks daily."
You should.
You should,
Okay,
yeah,
okay,
because you are
okay,
giving instructions. So you should, or it is very important to, or I recommend that you
okay,
change your socks daily. Okay, so it was a good attempt. Very good. I can see Dolphin has also joined. What we are doing today, Dolphin, is we are working on how to provide information using signposting, chunking, uh, topic sentence, and checking understanding. Right. Uh, so about the feedback for you, Manju, instead of starting this role play, how are you doing? You could have started by saying what brings you here today, because you are in a clinic, right? And then when you were asking questions about the cut, you could have asked, have you applied anything on it, or have you taken any treatment for it? And then explaining that if it is not treated on time, it can lead to complications. Here you could have explained why diabetic patients have high risk of infection is because of poor blood circulation and high blood sugar levels. So when you were trying to explain that they have left it very late, you could have explained by saying that, see, because you are diabetic, it is very important that you take immediate treatment for any injuries. What can happen if you don't take proper treatment is that the wound can easily become infected. And because of diabetes, the blood circulation is very poor and the amount of sugar is very high in the blood, and therefore it takes very long for the infection to heal. As a result, so that was the signposting I was talking about. Therefore, or as a result, the the wound can become infected and it can lead to ulcer formation. So if the wound doesn't heal or if the infection is not cleared, the last resort for us would be to cut that part away from the body so that we can prevent the further spread of infection. So explaining why amputation is because if the infection doesn't stop from spreading to other body parts, then the only solution is to cut it off so that infection doesn't spread to other body parts. So explanation always has to be a detailed one. You did a good job in explaining dressing and antibiotics, but there also you did not use signposting. First of all, we need to clean this and apply antiseptic lotion, and the dressing needs to be done every alternate day or so. Secondly, the doctor will prescribe you antibiotics to clear the infection, right? So now when we do it for the second time, make sure that all of you are able to use those three skills. Using a topic sentence, now I'm going to explain you about the treatment, and then categorizing the treatment, and then checking, understanding. Am I clear so far? Do you understand so far? Is it clear so far? So what we'll be doing in the second round is that for the second time, I want Divya, you to start the role play and cover the first bullet point,
Okay, ma'am.
asking about the details of cut and the second bullet point as well, explaining them that they have left it very late to seek treatment. Then Manju, I want you to cover third and fourth bullet point, dressing, antibiotic, and proper shoe fit. And Dolphin, a last group of bullet points,
Yes, ma'am.
food care.
Okay.
Yeah. So again, all of you have about 15 minutes to prepare for this. Use the file that I have sent. Um, Dolphin, if you don't have, I'll send it again for you.
Yes, ma'am.
Okay, I've sent the file in the chat box. It has those 3 tools I'm discussing. Providing structure has 3 tools. So you can use that while you're having the role play.
Which one, ma'am?
The file that I sent earlier, Dolphin hadn't joined at that time, so she wasn't having it. So I've sent
Okay.
the same file again.
Okay, ma'am.
Yeah. So now I'll come back after 15 minutes. Till then, prepare for this.
Which one I want to do, ma'am?
You need to do the third and fourth bullet point.
Okay, ma'am.
Dressing, antibiotics, and proper shoe fit.
Okay, ma'am.
That replacing the dopamine, which is lacking in your condition, not any other, and it does not have any side effects as noted yet. So it will be good for you, and it will be good for your health that if you take medicines regularly. Okay.
I'll do that.
So okay, so now about the physiotherapy, what I can do for you is that I can just book a refer to physiotherapist, referral to physiotherapist, that he will explain you exercises in detail for your breathing, for your walking, and other any activities, and even also for your speech that you may find difficulties in speech in future, for prevention of it. So it will help you in that. But the thing I want to let you know that it is not optional that you can choose a physiotherapy or medicine. The thing is, you should concentrate on the both the things, and both the things will helpful for each other to just alleviate your symptoms. Would you understand?
Yes, doctor.
Okay, can I interrupt you guys here?
Yes, ma'am.
Yeah, okay, so that I can have another round of role play. So this time, who was supposed to start?
I was supposed to start.
Okay, yeah, go ahead.
Yeah. Hello, Miss Joyce. Nice to see you again. How are you doing today?
It's still the same,
Mhm.
as we met last time. I still have stiffness in my hand, and yeah, the left foot still is very painful because of the spasm.
Oh, I see. I did prescribe you L-Dopa medication. Are you taking those regularly?
No, I wouldn't lie because
Mm.
I am not very keen on taking chemicals, and because I don't have tremors as yet, I don't think it is necessary to take medications. I want to know more about alternative therapies. If I can replace medication with alternative therapy.
Yeah, it's actually quite natural to feel that way, that we do not want any chemicals to consume. But in your case, the medications are very much important to cure the disease. Let me first explain you what the disease is. Do you know much about the Parkinson?
No, I just know that people can have
Mm.
tremors and it can cause stiffness, but I don't really understand.
Oh, I see. Now the
Uh, okay, so basically, Parkinson is a disease in which our brain cannot produce a substance called dopamine,
Mhm.
and because of that, you see this different symptoms. Like earlier, like you mentioned about the stiffness, tremors. Along with that, you also get some speech impairments and disproportion of your movements. Okay,
I see.
so the cause or causes of Parkinson's not clear. Okay, majority of cause, in majority of cases, it is just unknown simply, but sometimes it may be associated with trauma or exposure to some toxins. But the majority are the unknown causes. And regarding the treatment part, the
Mhm.
mainstay of treatment is the L-DOPA, which you were prescribed in the last visit, because the L-DOPA is the same drug which your body lacks, your brain is not making.
Mhm.
Okay, that's why you are giving you the first L-DOPA as a first part of treatment, because in a research shows that in the long term it has a good outcome
Mhm.
compared to other drugs and less side effects. Are you getting my point?
Um, yeah, I do. But you know, all the chemicals have one or the other side effects, and then I'm at the age of 50. I would like to give preference to other modalities than taking medicines.
Yes, I can understand that at this age you don't want to get into medication, but let me assure you that uh, taking medication will make your life better compared to not taking. Because if you are not taking, more symptoms of Parkinson will appear
I
and it
see.
will disturb your lifestyle.
Mm-hmm.
So rather, it's good to take the medication.
Okay.
Okay.
Yeah. And how about physiotherapy? I have heard that physiotherapy can be very helpful in managing the symptoms.
Yeah, that's a good question you ask. As I have mentioned, for this difficult disease, the gold standard is the medication, but there are few allied things which will be helpful to make you comfortable and make your movements and your posture fit. So, should I tell you the benefits of physiotherapy?
Yeah, please.
Yeah, so physiotherapy will help you to maintain your posture. It will help you to maintain your the activities which you are feeling stiff at present, and sometimes it will also help you to do deep breathing exercise, which will prevent the chest infection that occurs commonly in patients with Parkinson's disease. So I hope I am making my point clear.
Jigish, can you do this again with signposting language or categorizing?
Yeah. So it's a good question you asked about physiotherapy. Uh, uh, let me explain you the benefits of physiotherapy. Physiotherapy, as I have mentioned you previously, the drug is a gold standard for the complex disease, but physiotherapy will help you to maintain your body posture as well as the body movements. Uh, it will also help you to prevent infection by suggesting deep breathing exercise. Uh, uh, have I explained you properly? Got my point?
Yeah, but then what I want you, Jigish, to do is to categorize
Mhm.
it by saying that first of all, doing exercises will help reduce your stiffness of the muscles, and as
Okay.
a result, the movements will be easier.
Mhm.
Secondly, some balancing exercises that will be done during the physiotherapy will improve your balance and it will reduce the risk of falling. Okay? You will
Okay.
feel much more confident while walking. And
Okay.
finally, physiotherapy would include some breathing exercises that would strengthen your lung muscles, and it will eventually prevent any complications related to breathing
Right.
in the future. So, whenever you are explaining benefits of something, and if there are three, four things, you don't
Okay.
connect them with and
And
also. You categorize them by saying firstly, secondly, finally.
but I thought it is second most important thing. No, most important thing is medication. So already we have explained all the benefits. So this
Hmm.
is not so much important as medication to explain in.
But here it says, and explain ways in which it can help.
Okay. Okay.
So, what are the benefits of exercise?
Right. Okay.
So, one sentence about each one of them would be fine. Like, you don't need to go too much in detail, but at least one sentence.
Right. Okay.
Okay, who is next?
It's the two.
Yeah. Yeah.
Yeah.
So,
So yeah.
Doctor, when if you have mentioned that physiotherapy is very beneficial, so I think that is much better option. Why do I need to take medications? Maybe I can combine physiotherapy with acupuncture. I have heard about acupuncture a lot.
Yeah, I agree that. But so from talking with you so far, I come to the conclusion that you are not comfortable with the medicine and you want to choose some other alternatives. Is it?
Yeah, if there is an alternative, then I want to prevent taking medication as long as possible.
So I agree that taking medication is not a pleasant thing. But let me tell you that from our discussion up till now, that you know that the Parkinsonism is a disease of the destruction, right? So
Mm.
in that, usually the chemicals which is produced in the body is called dopamine. It's destruct in the body,
Mhm.
so that we have to either make in the body or we have to supplement from outside of the body. Do you get
Mhm.
my point?
Yeah, I do.
So that there is, as we know that there is more destruction in the body, so our body cannot fulfill the requirement of the chemicals which already destruct.
Mhm.
So in your disease, unfortunately, we have to supplement the chemicals from the outside, like the levodopa. Levodopa is nothing but the same chemical which is produced in our body, but we
Mhm.
have to supplement it from the outside in the form of medicine.
I see.
You know that it's like
Mhm.
insulin, like because in our body insulin is produced, but
Mhm.
when the patient is diabetic and in that there is a destruction of the pancreas, so our insulin is not produced from our body, so we have to give insulin from outside in the form of injection.
I see.
So the same thing like this, in that we
Mhm.
have that is a good thing that there is no injection, we have to give medicine.
Mhm.
And for your disease, it is better to take medicine. This is the first priority, to take the medicine.
Mhm.
There are other modalities like exercise, acupuncture, massage. I know that these are, but it only help your symptoms, not the prevent your disease, or it's not the final treatment of the disease.
Mhm. Okay, makes sense, doctor.
Makes sense.
Yeah.
So unfortunately, the good thing is that we we have the medicine like levodopa in this condition. So we have to take medicine for lifelong. Unfortunate thing is that we have to take medicine for the lifelong, right?
Mhm.
But we can see the symptoms, how effectively it works. So according to your symptoms and according to how the drug is, that we can titrate the dose of the medicine, right? And
Mhm.
simultaneously, we will still continue the exercise or acupuncture or massage. This way, it help you to decrease your symptoms modalities.
Okay.
Is it clear to you?
Yeah. Thank you.
So,
Yeah,
yeah,
it's
sure.
okay. You can stop it here. So, yeah, how you could have made this response slightly shorter. Like, for example, if it is in continuation, right? So, what we can do is like when they say that if physiotherapy is so beneficial, why can't I just go with physiotherapy? So, your response would be, I'm glad that you are willing to do exercises, but the doing exercises cannot replace the chemical that is lacking in your body, and therefore all the measures that we have been discussing so far, the exercises or the other modalities like acupuncture, can only complement the treatment. They cannot alone be helpful in managing your symptoms, okay, or they cannot alone be helpful in preventing further deterioration of your symptoms. So if you don't take medication, there are chances that the symptoms can further worsen or the symptoms can further deteriorate. But if you take medication, we can be sure that the symptoms are managed, controlled, and at the same time, by complementing it with exercise, we can reduce the severity of the symptoms. Right? So that will be a shorter response when you say, unfortunately, these measures cannot replace or the L-DOPA, and it can be replaced only with the medication, and therefore they are just complementary measures. They alone do not work. They always work in combination with the treatment. So these are some very good phrases. In combination with, okay, or they are just complementary measures, or they just complement the medicine. So these can be used when you are trying to persuade the patient to take medication.
Sure.
Okay, so I think we have done a good job. All of you have been able to produce a lot of language today. I could see some very good responses as well. Um, Now, I just want to wrap up this session here with a note that today itself, I want each one of you to do this entire role play with each other. And when you are doing it, keep this table with you, and the other person will checking if the first person used topic sentence, used signposting, were they able to check understanding. These 3 points, right? So each one of you have to do it with the other one. One person will be playing the role of a patient and the other will be doctor, and then you can change your roles, and the one who will be playing the role of a patient will be checking if all these measures are followed by the doctor who's doing this role play. Do you guys have any questions before I move out from this breakout room? I'm not going to close this breakout room. I'm going to keep it open. So if any one of you still wants to try and do further speaking practice, you can definitely do so. So it is going to be there. All of you are going to be in the same breakout room, but I would be leaving. So if you have any questions, I can answer that first and then I would leave the room. If you don't have any questions, can you type all good for me so that I...
Ma'am,
Yeah,
it's Ovia.
yeah.
Can you just give us brief about how to start an intro in follow-up, like
Follow
having
up.
the side effects or something, or the new issue?
Yeah, okay, definitely. Okay, so say for example, if for this role play, if you had to start, yeah, I would start by saying, hello, Miss Joyce. I'm Priya. I'm sorry, it was my mistake. We don't need to introduce ourselves here. So just let me start it again. Uh, Hello. So, Miss Joyce, when we met last time, you were diagnosed with Parkinson's disease, and I had started some medications for you. So, today we have arranged this follow up to see how you're doing. So, before we proceed further, have you been taking those medications? Instead of saying, are you taking, the right question would be, have you been taking those medications? And they would say yes or no. And then at that point of time, I won't go on to explain. I would just move on to the next question. So how is the stiffness in your arms now? Or how are you doing? Or is there any change in your condition? How are you doing now? Or is there any change in your condition? And then they will tell me about the symptoms. And then I would start explaining that in your case, it's very important to take this medication So let me first explain you what is Parkinson's disease so you can have a better understanding of what you are going through, and then I would discuss about the importance of medication. Is that okay? And then you move on.
Ma'am, can you
Yeah.
say, is the medication working for you?
Yeah, that's, but if they have not been taking, then so whenever it is a follow up, it is always a good idea to first start by asking, have you been taking those medications? And if they say yes, I have been taking, then is it helpful? So then if you have prescribed pain medication, you would ask, so how is your pain now, or is it helpful? So it's always first a good idea to ask if they have been taking, and then about the symptoms.
It's a second visit. So probably first visit must have explained everything, no? Why we are explaining the second visit?
Yeah, so what happens a lot of times is that patients, when they are first diagnosed with the disease condition, they are not in the state of mind where they can understand or recall everything. So we might have explained, but they may not remember those things because they were very anxious at that point of time, or not able to yet accept that they have this disease condition. So it's sometimes very common for patients to say that, can you explain me again? Or, when you explained, I was very anxious, so I couldn't follow. Can you explain me again? So that is the reason why it is being explained in the second visit as well.
It is understood that you are the same doctor who has prescribed it, or
Yeah, here it says you prescribed L-Dopa.
okay.
So it is the same doctor prescribed. Any other question?
No. Thank you,
No?
madam.
Okay, great. So you guys can continue practicing, take turns, and the rest of you can see if the other person is able to implement the strategies we have learned. Give peer feedback. It's really helpful, giving feedback to each other and reminding each other that they need to use this or that. Okay.
So who is playing now?
Anil, I have allowed you to record whatever you will be doing so that, if you can send that recording later on, I'll have a look at it and see how all of you did.
Okay,
So
ma'am.
I have enabled that function for you. You will be able to record this.
How do I start recording?
See, does it show in your menu bar the recording option? Those ellipse, the 3 bullet points that you have, 3 dots. There, if you see the option of record.
Red dot coming of recording.
Yeah, great. Go ahead.
How do I know that it is started? Recording has started.
That's
There
already
is this red dot. Right now, because I'm here, it is being recorded from my side. But as soon as I leave, it wouldn't be recorded any longer from my side. So then you need to record it.
Okay, ma'am.
Okay, so are you guys now prepared? Divya is supposed to start this time, is it?
Yes, ma'am.
Okay, so let's get started.
Okay, ma'am. Hi, good morning. You bring here?
Good morning. So you need to first introduce yourself and your role,
Okay,
Divya, and then what
okay,
brings you here today.
okay, ma'am. Hi, good morning. I'm nurse Divya. Why you bring here?
What brings you here
What's
today?
bring?
What brings you here today? Or you can say, what are the concerns for the day? What are the concerns for the day?
What are the concerns? Okay,
Yeah, what are the concerns? What are the concerns for the day?
concerns for the day. Okay, ma'am.
So, I'm here, nurse, because I have got, this swelling in my left foot, and
Okay.
and I'm really worried about this because it is causing a lot of pain. So can you have a look at it?
Um. Oh, okay. Can I ask you some questions regarding of the cut?
Yes, please.
Um, when it happened?
About 6 weeks ago, I was working in my garden, and
Okay.
that's when I got a cut because of a small metal piece.
Oh, sorry to hear that. Did you have pain?
At that point of time, I did not have pain because it was a very
Okay.
small cut.
Okay. Did you apply any ointment or cream?
No, I didn't. I thought it was just a tiny cut, so it would heal on its own.
Okay. Did you diabetic?
Can you repeat your question? I couldn't get it.
Uh, did you diabetic pain? Like,
I am diabetic.
okay. Mm, it will happen 6 weeks before, no?
Yeah, it happened 6 weeks before.
Okay. Um, it may cause. It may cause ulceration in your feet. As you can take antibiotic as well as maintain your blood glucose level.
I see. Is it very
Uh,
serious, nurse?
uh, yeah, you will untreated means possibly to amputation your feet.
I see. You mean to say I need to cut my leg off?
Not like that. You can follow and you can take antibiotics and you maintain your blood glucose level. Uh, then proper dressing your feet.
Mm-hmm.
You can prevent further infection uh, that area.
Okay. Okay. Who is next? Manju? Yes, go ahead, Manju. You're muted. You need to unmute yourself first.
Can you hear me, ma'am?
Yes.
Yeah. Okay. Sorry to hear that. Don't worry. We have some effective strategies to heal a infected cut.
Mm-hmm.
Um, so we can do the dressing, and we got some antibiotics for that.
So instead of that, can you use signposting language here and explain both the things
I
in
will
detail?
explain to you one by one.
And
Is
then
that
saying
okay?
first of all.
Is that okay?
Yeah.
Okay. First of all, I will explain to you regarding the dressing.
Mm-hmm.
If you come on dressing, okay, if you come to the hospital on a regular basis to do your dressing, that will help you to heal your cut uh, as quick as possible. And it is not painful, you know. They will do the right dressing for you, and that dressing will be fast and effective as possible to heal your cut.
Okay. I can do that.
That's good. So it will definitely help to prevent further infection and ulceration.
Mm-hmm.
Did you get me?
Yeah.
Okay, that's good. So in addition, secondly, uh, if you take your antibiotics without any complaint, definitely it will heal very quickly.
Mm-hmm.
So, are you going to do that?
Yeah, definitely. I would take medications. I just want to, recover from this as fast as I can.
So that means you're happy to do the dressing, and along with that, you're happy to take the antibiotics as
Yeah,
well. That's
yeah,
good.
yeah.
That's great. Okay. Let me explain to you in detail regarding the proper care of the food set.
Mm-hmm.
Is that okay with you?
Yeah.
Okay. So it's very important to take care of the food. Firstly, if you go to the shop, they will help you to measure your food to choose
Mm-hmm.
the right shoes for you,
Mm-hmm.
and it will help to prevent the friction and lacerations of skin. Uh, it will lead to cut and cuts.
Mm-hmm. It
So
will prevent. It will
it will
prevent
prevent, yeah,
cuts.
it will prevent from cutting the food.
Hmm.
So, do you think you can do that?
Yeah, yeah. That's pretty simple. I can do that.
That will be great. So,
Okay.
yeah.
Over to you, Dolphin.
Sorry, ma'am.
Okay. Now it is Dolphin's
Okay.
chance, Manju. Yeah.
Okay, thank you.
Dolphin, are you prepared?
Hello?
Yeah. Go ahead.
Okay. So, as far as the condition, there are some of very effective strategies to cope up with the diabetes. I think with your present condition, you
Mm-hmm.
need to take good care of yourself so that you can avoid any harm to yourself, neither knowingly nor by mistaken. So, shall I recommend you some essential present condition?
Yes, please.
Hello?
Yeah, please go ahead.
Hello? Hello?
Yeah, you can go ahead, Dolphin. Yes.
Hello, ma'am.
Yes, please. You can start explaining.
Hello, ma'am.
Yeah, you can start explaining, Dolphin. I can hear you.
Hello? Hello, ma'am.
Yeah, I can hear you.
Hello, ma'am.
I can hear you. Go ahead.
Okay. We have very some good effective strategies to cope up with your present condition. You need to take good care of yourself so that you can avoid any harm to yourself, neither knowingly nor by mistaken.
Okay.
So, shall I recommend you some essential food care for your present condition?
Yes.
Firstly, you need to inspect your food daily. You need to check for any cut or redness or any blister or swelling. This will give you idea for your further management of your wound.
Okay.
Okay? Are you
Yeah.
okay with this?
Yes.
Yeah. Secondly, keep your feet clean and dry, especially the areas around the toes.
Mm-hmm.
Avoid to expose your feet in water for a long time. This will make your skin soft and you are at the risk of the infection as your feet may be very wet. So it is necessary for you to avoid your feet in exposure to the water.
Okay.
Is that clear? Are you okay
Yeah.
with that?
Yeah.
Should I continue further?
Yes, please.
Thirdly, keep your toenails trimmed and cut across the toenail. This helps to avoid injury caused by the nails to the side of your toe.
Mm-hmm.
Okay?
Yeah.
you don't mind, can I ask you how frequently do you change your socks?
Once in a week.
Oh my God, that's very strange. But my final advice and recommendation is you should try to change your socks every day. You should wash them every day and need to wear a new one. This will help you to keep your this will help you to avoid the infection, and also this will increases the blood flow and prevent infections.
Okay.
Do you think you can follow this?
Yeah, I can. I can. I think it's now important for me to follow these things, so I would follow that.
Hello.
Yeah, I would definitely follow that. Okay, so now the feedback. Okay. Divya, it was a good start from you, but then I noticed some errors in
Further questions do you like to ask?
No, no. I'm giving feedback now, Dolphin. I'm giving feedback. So for Divya, you know, I noticed some issues with the tenses and the sentence formation. Like, um, when will you do something? But you wanted to ask about the past. So when did you notice this, or did you take any treatment instead of saying will you take any treatment? So there were some errors in the use of tenses. So you need to work on that area, and some errors in forming the sentences appropriately. It's not the natural way how English is spoken. So one way through which you can improve this is if you will go to the beginners section of speaking, you will see that there are some transcripts given. Okay, so going through the transcripts will help you make proper sentence, a full and complete sentence. Another way through which you can improve this is by listening to consultations on YouTube. Because basically there is issue with the language, the grammar and expressions, and the issues can create confusion for the listener. So you need to expose yourself to more English so that you understand the correct use of tenses. Yeah. So Manju, initially you forgot to use signposting, but then you were able to use signposting later on, so that was up to the mark. And some of the words, like as I said, it will prevent friction or it will prevent cut, but you mentioned it will lead to cut. So those kind of errors are to be avoided. um, Dolphin, when you were trying to explain the food care, it would be helpful if you can explain them why is it necessary. So if you you could have started this by saying that as you know that this cut has now become infected, and this is very common for diabetic patients. They can easily get infections, particularly in their foot. So now I'm going to give you some measures that you can take to prevent such problems in the future, so that they would be able to adhere to this very strictly, because they know that if they follow all these measures, then they can prevent this kind of ulcer in the future. So basically all these instructions were to prevent any infection or any injury in the future, because in diabetic patients, infections and injuries can take long time to heal. So instead of that, if they follow these measures, it can be prevented. Yeah. So,
Yeah.
Dolphin, for your side, the language part